Hello, and welcome to the Sioux Specialty Hospital's Total Joint Academy. At SFSH, we are committed to providing service excellence. We will do everything we can to help prepare you and assist you through your surgical journey. This presentation goes hand in hand with our Total Joint Academy packet, which is also located on our website. If you haven't had a chance to view this packet, please take a moment to download it at this time, as it contains many things you need to know regarding your surgery. Please note the blue correlating packet page numbers located in the upper right-hand corner of this presentation. You should receive a risk assessment prediction tool, or what we call a RAPT form, in the mail from us. When you receive this form, please fill it out and bring it with you to the hospital on the day of your surgery. If you have any questions regarding this form, please contact one of our discharge planners at the Sioux Specialty Hospital. Our phone number is located on the front page of your packet as well as on our website. The goal of this presentation is to provide you with valuable information regarding what to expect before, during, and after your surgery, as well as give you the opportunity to learn and think of questions that you may want to ask your surgeon. All right, let's get started. First, I would like to introduce you to your surgical team. On page 3 of your packet, you will find a brief description of the individuals involved in your care. These individuals all play a key role in aiding you through this process. Please take a moment to review your surgical team, and please note some of the individual abbreviations we often use when referring to these individuals, such as PA, PT, and OT. In preparing for your surgery, we will start with physical therapy. Physical therapy will begin either the day of or the day after your surgery, depending on your doctor's preferences. While in the hospital with us, you will be expected to participate in 2 physical therapy sessions per day. Additionally, individuals having a total knee replacement will begin outpatient therapy within a few days of leaving the hospital. If you know where you would like to go for outpatient physical therapy and are able to schedule your first appointment ahead of time, please do so, as you may have a better chance of getting the date and time you prefer. Upon discharge from the hospital, you will receive a prescription stating your doctor's PT protocol to give to your outpatient therapist at your first outpatient visit. If you are having a total hip procedure, you will not do outpatient physical therapy unless specified by your surgeon. Some surgeons will have you see therapy at your return appointment with your doctor. Standard total hip replacements will need to follow hip precautions for roughly 8 weeks in order to prevent hip dislocation. This includes not bending your hip into more than 90 degrees of flexion, so watching out for low toilets and chairs, not crossing your legs, and not letting your toes rotate inward. Anterior total hip replacements do not need to follow these precautions unless otherwise stated so by your surgeon. Here is a time frame of when you may return to some specific activities. You should be cleared for most activities by 8 weeks post-procedure. Driving will depend on which leg is operated on, the use of pain medication, and your strength and reflexive abilities. Please expect to not drive at least until your 2-week return appointment with your surgeon. The exercises I'm about to show you are meant to help strengthen you prior to your surgery. We recommend doing these exercises twice per day in the weeks leading up to surgery. To complete these exercises, we recommend sitting or lying on the bed or sofa. If any of these exercises are painful for you to do before surgery, please refrain. Additionally, there is a copy of these exercises located in the Total Joint Academy Patient Handbook that was mailed to you. These are some isometric exercises, meaning you simply tighten the muscle. First is a quad set. This strengthens your quadricep muscles located on the top of your thigh. Follow this picture by squeezing the top of your thigh, where the X's are, and pushing your knee flat against the bed. Hold tight for 10 seconds and release. Repeat this 20 times. Next is a hamstring set. This strengthens the muscle on the bottom of your thigh, your hamstrings. Tighten the muscles on the back of your thigh by digging your heel down. Hold for 10 seconds and release. Repeat this also 20 times. A heel side should be completed while lying on the bed or the couch. Bend your knee as far as comfortable and hold for 5 seconds and release. Repeat this 20 times. Next is a short arc quad. Use a rolled up towel or a coffee can, something that will hold its shape, and place it under your knee. Tighten the muscles on the top of your thigh and straighten your knee. Hold for 10 seconds and release, and repeat it 20 times. A straight leg raise is just as it sounds. While keeping your knee straight, lift your leg 6 to 8 inches off of the bed. Hold for 5 seconds and release. Also repeat 20 times. Last is a long arc quad. From the seated position, raise your leg and straighten your knee. Hold this for 5 seconds, release, and repeat 20 times. You may have to rely more so on your arms in the days following your joint replacement while using a walker or crutches. Therefore, we recommend arm strengthening exercises to assist you post-operatively. Chair push-ups are just as they sound. When sitting in a chair with arms, push yourself up and release 20 times. For bicep curls, shoulder raises, and rows, you can use some form of small weights or even soup cans, anything that you have available. As you may have now realized, preparing for your new total joint begins several weeks prior to surgery. On page 5 in your packet, there is a checklist that can assist you in assuring all necessary appointments and phone calls are completed prior to surgery. You will need to make sure you have surgical clearance from your primary care provider and possibly some indicated specialists before you undergo your procedure. This must be completed within 30 days of your surgery. Additionally, we recommend completing this as soon as possible within that 30-day time frame, as you may need additional testing completed before you are cleared. Next, a nurse from the Sioux Specialty Hospital will contact you 2 to 3 days prior to your surgery to verify your medical history and medication list, as well as confirm your scheduled procedure time. He or she will also instruct you on pertinent instructions regarding eating, drinking, bathing, and other pertinent things regarding your procedure. In preparing for surgery, it is essential to make sure that your home is ready. We recommend getting all essential daily needs on one floor if possible, as it can be challenging to navigate stairs. We also recommend preparing meals ahead of time, as it can also be difficult to cook when you're using a walker or crutches. Remove all rugs, cords, and other items that could cause you to trip. And please make sure that you have clean linens and clean towels to use after surgery, as this will help reduce your risk for infection. Some people find it difficult to take care of pets as well as getting the mail in the following days after their joint replacement. Therefore, please line up assistance with these tasks. If you have assistive equipment, such as a walker, crutches, or cane, please get these items out and ready for use. However, if you do not own them, please do not go out and purchase them before surgery, as usually insurance or Medicare will cover them after your procedure. We will assist you in ordering these items while you are in the hospital. If you have the ability to have railings or grab bars installed in your shower or on your stairs, this can be helpful. If not, do not worry, we will teach you how to safely navigate without them. In the weeks before surgery, please begin the strengthening exercises located at the beginning of this presentation, as well as in the Total Joint Academy pamphlet that was mailed to you. Good nutrition is also important before and after surgery to aid with the healing process. Please refer to page 17 in your packet for a balanced diet reference. Smoking is the leading risk factor for surgical complications. We strongly recommend that you stop smoking as far in advance from your procedure as possible. You may be required to stop certain medications prior to surgery. Please check with your primary care provider or your surgeon regarding the use of blood thinners and NSAIDs such as ibuprofen, Aleve, Motrin, and aspirin. You will be required to shower the night before and the morning of surgery with a high-quality antibacterial soap. If you were given a special soap from your surgeon's office, please use this as directed. We ask that you remove all nail polish or artificial nails prior to your procedure. We recommend that you take care of all dental needs prior to surgery, as your surgeon may require you to wait a few months post-operatively for routine dental needs. Also, you will not be able to eat or drink anything after midnight the night before your procedure. The preoperative nurse will instruct you with any alternative recommendations, such as clear fluids before your procedure. Next is a list of items to bring with you to the hospital. Insurance and prescription cards, all labeled medication bottles, comfortable and supportive shoes, loose and comfortable clothing, toiletries, cell phone chargers, pillows for the car ride home, a CPAP if you use one, and walkers or crutches, or canes if owned. Items to leave at home: large sums of money, valuables, jewelry, vitamins, pain medications such as narcotics, and larger suitcases, as our secured locker area is of limited size. Next, we will cover information regarding the day of surgery. The morning of surgery, it is essential that you shower as instructed per the pre-op nurse's instructions. Take your instructed medications, do not eat or drink except as instructed by the preoperative nurse, and arrive on time. Additionally, we recommend you utilize valet parking and check in with registration upon your arrival. After checking in with registration, a preoperative nurse will escort you back to your pre-op room. Upon arrival, you will be given 6 chlorhexidine disinfectant wipes to clean your body from chin to toes, as well as 4 nasal swabs of iodine to clean both nostrils. This decreases the amount of bacteria on your skin, reducing your risk for an infection in your surgical site. You will then be asked to change into a hospital gown. The nurse will review your health history and medications. An anesthesiologist will meet with you to discuss anesthesia and pain control options, and we will take your vital signs, draw labs, and place an IV. Your surgeon will then meet with you, verify the procedure, and mark your surgical site. From pre-op, you will be escorted back to the operating room for surgery. Surgery will last anywhere from 1.5 to 2 hours. You will have the choice of spinal or general anesthesia, which you will discuss with the anesthesiologist before surgery. Either way, you will be asleep for the procedure, and an airway will be placed to help you breathe. You may have a sore throat when you wake up. After your surgery, your surgeon will visit with your family or friend regarding your procedure. Your family will be asked to wait in our reception area until you are awakened and ready to transfer to your overnight room. From the operating room, you will be transported to our post-anesthetic care unit, or our PACU. You should expect to be in this area for 1 to 2 hours. During this time, nurses will be taking your vital signs and offering you pain medication. You may also be given warm blankets, have oxygen in your nose, and TED hose, such as compression stockings, to reduce swelling in your legs. You will also have what we call SCDs, or sequential compression device wraps, to promote circulation. X-rays will be done on your surgical extremity. Your family will be notified when you are ready to be transferred to recovery care or your overnight room. Upon arrival to the recovery care, you will be oriented to your overnight room. Your nurse will complete an assessment and obtain your vital signs. At this time, you will be reunited with your family. Your belongings will be delivered to your room. There will be a pull-out couch for a family member to stay with you if they so choose. You will also be given menus for dinner. Visitors are allowed 1 meal per day in addition to a continental breakfast in our recovery care visitor area. Moving on to your recovery. Here's a list of what to expect the day of surgery. You may get up to the recliner or rest in bed. You may have a catheter in your bladder, or we will assist you to and from the bathroom. Depending on your surgeon's preference, you may see physical therapy. You will use a walker to ambulate as tolerated, and we will place a belt around your waist to help stabilize you. You will be offered fluids and a light meal to start, as your stomach can be slow to awaken following anesthesia. You may progress to normal food as tolerated. You will have an IV in your arm and a drain coming from your incision. You will also wear SEDs or sequential pumps and TED hose or compression stockings on your legs to help reduce your risk for blood clots. You will either have a polar cooler or an ice pack on your new joint. If you are having a total knee replacement, you may use a CPM, or what we call a continue passive motion machine, to help mobilize your leg following the surgery. You will be shown how to use a Volyrex, which is a breathing device to help exercise your lungs. And as previously stated, you will need to use a walker when ambulating. The day after surgery, you can expect to see a physical therapist, an occupational therapist, a discharge planner, as well as your doctor and/or PA. Drains, catheters, and IVs will all be removed if possible. Labs may be drawn to check your blood levels and electrolyte status. You will be expected to ambulate in the hall and practice stairs with physical therapy. The nurse will change your surgical dressing and may help you shower and dress into your own clothes. As long as you meet safety requirements with physical therapy, your pain is controlled, and you are medically stable, you would most likely be able to discharge home. Upon arrival to the specialty hospital, we will begin inquiring about your pain level. We use a 0 to 10 scale, with 0 being no pain and 10 being the worst possible pain. A nurse will assess your pain every 2 hours. We expect your pain to be tolerable at rest, however, you will likely not be pain-free, especially when you're moving. With that said, it is easier to be proactive with pain control. It is better to take pain medication when your pain is at a 4 or a 5 than wait until it is at a 7 or an 8 out of 10, as it takes approximately 45 minutes to an hour for pain medication to take effect. Pain medication also may upset your stomach, so please take it with food. Alternative therapies such as ice packs, music, and relaxation may also prove to aid with pain relief. Next are some different medications for pain relief. Many individuals require narcotic pain medication for the first week or 2 following a joint replacement. The side effects of narcotic medications include constipation, nausea, drowsiness, dizziness, and itching. With this said, we recommend being proactive with your bowels ahead of surgery. Additionally, you should not drive, operate machinery, or drink alcohol while taking narcotic pain medication, as alcohol may increase your drowsiness. Other medications vary, and we will specify everything you need to know regarding any new medication we give you. We encourage you to take a stool softener after your procedure to help with constipation caused by anesthesia and pain medication. You will also be on some form of a blood thinner following your procedure in prevention of blood clots. If you currently take a blood thinner, we will strive to get you back on your normal routine. You will be prescribed 24 hours worth of prophylactic antibiotic therapy while in the hospital to help reduce your risk for infection. However, you will not be sent home on antibiotics unless otherwise instructed by your surgeon. Either the day of or the day following your surgery, a discharge planning nurse will visit with you regarding your plans for home. They will also assist with ordering any equipment you may need. If you are in need of inpatient rehab or swing bed, they will also assist with these arrangements. At the specialty hospital, we try to take you and your family's preferences into account. However, please note that people typically do very well after a total joint replacement and are often safe to discharge home. If you have any questions regarding inpatient rehab qualifications, please contact our discharge planning team at 605-444-8205. No matter how prepared you are for home, it will be an adjustment. You will likely experience anxiety and may question whether you are ready to be discharged home. Please be assured that this is a normal feeling. We will do everything we can to assist you with the transition, but you can do it. Please do not compare your surgery to anyone else's or even to a previous surgery that you've had. Each surgery is unique and each person heals differently. Upon discharge, a return appointment with your surgeon will be scheduled for you for 10 to 14 days postoperatively. You will be prescribed pain medication, a blood thinner, and stool softeners, along with any other necessary medications. You will be sent with exercises in which you will be instructed to complete twice daily. If you had a total knee replacement, you will be scheduled for outpatient therapy 2 to 3 times per week for the first 3 weeks. You will then discuss further therapy with your physical therapist. You will need to use a walker or crutches for the first week or 2. You will also be given TED hose or compression stockings to wear during the day only for 4 to 6 weeks. You will be sent with either a polar cooler or ice packs to use as needed for comfort and to reduce swelling. We recommend icing after exercising, walking, and if you have increased pain or swelling. You will be sent with supplies to dress your surgical wound. There's no creams or lotions to your incisions, and we want you to watch your incision for signs of an infection such as redness, swelling, pain, drainage, or a temperature over 100 degrees. You will be instructed as to how to shower. However, you may not submerge your wound under water. No bathtubs, pools, or hot tubs. You will also be given information regarding the need for antibiotic prophylaxis prior to any invasive procedures such as simple teeth cleanings, colonoscopies, and other surgical visits. The following slides are some frequently asked questions. Please review and contact the Sioux Falls Specialty Hospital with any additional questions that you may have. This concludes our presentation. Thank you for taking the time to learn and better prepare for your new joint. We look forward to seeing you soon.